Good morning. My name is Michael Carney. I'm the Senior Vice President of Emerging Issues at the U.S. Chamber of Commerce Foundation. We have been working to defeat COVID-19 since early 2020. That work continues today in the United States and around the world through the Global Task Force on Pandemic Response. I'm honored today to welcome two distinguished guests who represent the broad collaboration that's allowed us to make so much progress against this deadly disease. You may know Andy Slavitt from his appearances at the regular COVID-19 briefings from the White House. He is a veteran of business and public service who is now helping lead the United States response to the pandemic. From the private sector, we have Dave Clark, the CEO of Amazon's worldwide consumer business. Dedicated Amazonians have kept us fed and supplied, even in the darkest days of the pandemic. Amazon was an early leader in workplace COVID-19 testing and is now hosting vaccination clinics for employees and communities, an important contribution to our collective efforts to vaccinate America. Thanks to both of you for taking the time to join us for today's discussion about how the United States has gotten back on track. We're clearly not out of the woods. COVID anywhere is COVID everywhere, but conditions have improved in recent months. This is thanks to the continued vigilance of the American people and the unprecedented partnership between government and industry that enabled us to do things like bring new vaccines and therapeutics to market. So Andy, thanks for joining us. I'll throw the first question to you. How confident are you in the recovery? And is the worst behind us, or is the White House concerned about future surges like we saw in the winter?
Well, thanks very much for having me and having us on, and it's great to be with Dave. Look forward to this conversation. Look, I think we've had a spate of good news, and as with bad news in this pandemic, good news in this pandemic comes exponentially as well. So when you vaccinate a lot of people, cases shrink pretty rapidly. In the last 2 weeks, cases have shrunk 30%. We now have very good data that the vaccines not only work in labs, but they work in real life. We have good data that the vaccines are effective against the variants. Credit to our scientists and years of research. Now, everything's not solved. You know, there are, as we all know, a set of challenges ahead of us. There's a set of Americans who are still considering whether they want to get vaccinated, and much of our recovery will depend on how they decide. But importantly, I think we need to respect people's processes, respect the fact that people who haven't gotten vaccinated yet, many of them have questions that they need answers to. Many of them want to see what happened with the vaccinations that went before them. So if you've been vaccinated, talk to people, tell them what the experience was like, have them talk to their doctors, have them talk to their pharmacists, help them understand why it's important, but respect the fact that people need to make their own decisions. We also have to make vaccinations easier. And then I think, as I'm sure we will talk about, our job is not done even if we end up being successful in the U.S. Many of you have friends, colleagues, families, and operations across the world, and understand what a fortunate position the U.S. is in to have these vaccines available to us at a time when people around the world are going through really difficult challenges. And the U.S. has got to take its leadership role seriously and step up and help with that too.
So Dave, it's hard to believe that it's only been a year or a little bit more than a year since the pandemic began. But back then, as we went into lockdown, your company became a critical service for much of the country. How did you react to the giant disruptions in supply chains, but also find ways to keep employees safe?
Well, first, let me say I'm really happy to be here with you and Andy today, and I'm really grateful for the leadership of the Biden administration over the last few months and setting some audacious goals for getting the country vaccinated and the progress we're on there. As Andy said, there's some real light at the end of the tunnel there that I'm excited about. I really want to thank Michael, you and Suzanne and the whole team, as well at the U.S. Chamber, who have also done a fantastic job over the last year supporting business in the U.S. and helping sort of around the world, companies and people deal with the pandemic and the challenges that everybody's faced for the last year. You're right to talk about the supply chain disruption. I mean, it's really, we've never seen anything like it. I can't think of anything in my sort of professional life that's disrupted as broadly as this did, from everything from the customer front to where and how people can leave their home and where they can shop, all the way back to the manufacturing source points, whether that be in the U.S. or anywhere around the world. I think we all learn just how interconnected we are as a society and a global society, and what happens in one country and in one part of the world, how it impacts all the rest of us. And we've been, I think, as businesses around the world and Amazon have been dealing with that and working to get supply chain disruption repaired and back in place for consumers over the last year, and continue to work through that. And I think will for some time. Our initial challenge was we were faced with unprecedented demand. All of a sudden you have this mix of customers who can't leave their home, and everybody needs things delivered and wants things delivered so they can stay safe. And we're trying to balance that with how do we also keep our own workforce safe. We have the second largest workforce in the U.S. Over 800,000 people, and most of those folks need to come to work every day to do their jobs. And we had to pivot quickly to how do we change hundreds of processes and put social distancing into our facilities, and trying to source daily masks and PPE for almost 1 million people to operate every day. And so every aspect of our company pivoted to be able to address those. You mentioned it, but maybe one of the most important pieces of that was actually testing and building out. We had a great partnership with government agencies to help support that and build out our own internal testing labs, which have now tested millions of employees in the U.S. and abroad, to help help us spot where we were having challenges and help catch things early, given how many asymptomatic cases there actually were, and to prevent the spread in our workplaces. And we're now pivoting. As we see this great work in vaccines, we're pivoting that work into on-site vaccination clinics and vaccination processes for our local communities and our employees. And we're excited about that and what that means for our workforce and for our communities as we go forward. So.
Just a quick follow-up on vaccines, because that's definitely the path back to public health. When we think about work sites, is there anything else that we should be doing to ensure that essential workers have access to vaccines, both here and abroad? It's come up, with a number of companies that they're very eager to ensure that their employees have access to these safe and effective vaccines.
Well, we've been in this place of, so many of our employees have been coming to work for the fullness of the pandemic, and you have this. There's a lot of folks who have been ready and willing and supercharged to go out and get the vaccine. But there's another population that is looking at it like, I've been coming to work. There's some hesitancy there. And when we talked to people, we saw that. And that's why we moved to get on site. We did these public-private partnerships and partnerships with other entities to help us come on site to vaccinate our teams. We do on site now at over 250 locations around the U.S. And we see substantive increases, double-digit 20+% increases in the amount of people who immediately start to go get vaccinated when we can just simply remove the friction relative to having to leave, having to go to another location to do it. We also see that people adding some incentive helped. We put in an $80 payment to people who get vaccinated, $40 for each round of the shot, or $80 sort of total, plus some unpaid time off to people, trying to give people opportunity to, if they were worried about, how they might feel with the vaccine, give them flexibility to manage it. And we found that was very well received. And then I think the guidance we just got from the CDC is big. This ability to be able to be, if you've been vaccinated, to not wear a mask indoors, and how safe you are as a vaccinated individual, I think is going to go a long way to helping reduce hesitancy.
Not surprisingly, Dave's hit on a lot of the right and successful points. Here's what we know from data that just, I think, supports a lot of what Dave just said. First of all, the number one thing that employees say is getting in the way for them to getting a vaccine is paid time off. And you might say, well, gosh, that's easier for larger employers to do, but at a small employer, it's hard. And it is harder because you rely on each person. But the federal government has put forward, as the chamber knows, and as many of you know, a tax credit for giving paid time off to people when they go get their vaccination, and if they feel like they're going to feel a little bit under the weather afterwards. We don't want anybody to feel like they've got to lose an hour of pay, and a lot of people are worried about that. I think particularly in the Hispanic, Latinx population, if you have Hispanic employees, communicating with them, letting them know they're eligible, giving them the time off, letting them know that there are resources in Spanish. Number two, I'd say is I think it's a good thing to talk about at the workplace. It's a good thing because people don't. Here's a shocker for everybody. People don't necessarily want to hear from the government about a topic like this. They may or may not trust what they hear from the government or even the CDC. People do trust the people they know, and they trust the people they respect locally. They trust their colleagues and coworkers. They trust the medical officer if there's one in their company. They trust the local hospital, their doctors, their physicians. Encourage people to talk to people they know and to talk to people who've been vaccinated, because this is just people doing their homework. Let's not think of them as reluctant. Let's not even put a label on them. Let's just say that their decision-making process is such that they want to know some things before they make this decision. And so make that okay. Provide them that information. And I think more people will make the right choice because these are very effective and safe vaccines. And then removing every obstacle possible. We now have most places you go have walk-in appointments. So it's much, much easier. And people may remember these horror stories from January and February where you had to get through like 7 websites and other things. It's not that way any longer. And let them know that.
So Andy, let's build on what you just were talking about, because that tracks with everything that we know. One of the other things that we've seen in recent research is you can help overcome any hesitancy in the workforce by making it as convenient as possible for people to get the shot. So this week, I think the White House announced that jurisdictions are going to get 28 million doses. 2/3 of them are going to go to the states. We know that, again, from research, that worksite vaccine clinics can increase willingness to get the shot. Do you think that we'll ever reach a point at which the federal government will help allocate doses to large employers, or that we'll see increased emphasis on worksite vaccine clinics? Or do you expect all of that to remain with states and localities?
So my answer is yes and yes. In that, number one, we do think that both on-site and near-site clinics are effective for exactly the reason you just said. We also think, as we studied this, we asked ourselves the question, who's most efficient at doing those? Is it the federal government or the state government? And we determined that by and large, it's the states. The states are going to be much better at it because they know their employer size and sites. That there aren't that many. If the country was filled with only multi-site, multi-state employers, like Amazon, it would be one thing. But for most people are within a single state. Most states have an abundance of vaccines. So I think if you got a hold of the public health officer or the vaccination effort in those states, whether you're in multiple states or whether you're just in one state, I think that's going to be successful. And the work we did suggested that states are actually doing a lot of on-site and near-site. Now, I have one more suggestion for you, in that I've talked with both CVS and Walmart and Walgreens and others, and many of them will provide a partnership. They will either come on site, they'll create special hours, they'll come nearby, they'll bring a car or van. So if you feel like, gosh, if we had near site or on site, we could do more vaccinations. My suggestion is to connect to one of the big pharmacies nearby, and they can correct me if they disagree. But I think many of them will be happy to figure out how to make it more convenient for your employees.
Yeah, I just reiterate that. We've seen the same thing. States incredibly cooperative in participating with on-site events, and we've partnered with a number of different organizations and pharmacies to help us do those on-site vaccines, and it's worked fantastic. So I encourage other companies to do the same.
So shifting gears for a minute away from vaccines to testing, it's something that we struggled with early on in the pandemic. At first, we didn't have enough capacity and we weren't testing a broad enough group of people. Now we have robust testing capacity. I mean, I saw one estimate that it's somewhere around 500 million a month, maybe. But fewer people are electing to get tested. So Amazon was a leader in worksite testing. Are there lessons that you learned through that process that we can use either in a governmental way or other companies can learn from as we look at the next stages of the pandemic? And do you see testing as something that your company is going to continue with, even though vaccines are widely available?
Yeah, it's a great question. We did testing in particular in the early days, and I would say not even early, all the way up till now has been an integral part of our overall safety protocols and creating a very easy, efficient way for people to do testing on site. I think, one of the big takeaways I would think if I were writing an after action on what to do, what we learned from this pandemic, one of the things that I would take is how do we spin up testing industry and broad testing capabilities in one of these kind of events faster? Because we found it so important to our processes that I can't imagine sort of having done the last 9 months without it. It's so important to be able to catch, particularly asymptomatic cases in individuals early in the process before they have a chance. It's where you get a chance to catch it before it spreads. It's putting the fire out before it really starts. And that has been incredibly important. I think as far as how do we go from here with testing, we continue to test and we expect we will for the foreseeable future. Again, as Andy said, people will, the majority of people I think are going to, get vaccinated. And while others continue to investigate and understand their personal approach to vaccination, testing provides an opportunity to continue to see what's happening with COVID in our workplace in the months ahead. I think you'll see that the testing quantity reduce because, as the vaccinated population grows, fewer and fewer people who are vaccinated will feel the need, or have the need to be tested. And more of the testing will focus in on people who have chosen for whatever personal reason not to be vaccinated at this point.
So, Andy, when you think about testing, what kind of messages do you want people to walk away with? Do we want people to still aggressively make use of public testing facilities now that vaccines are everywhere? Like, what's the current thinking from the administration about testing?
Well, look, one thing that encourages me is the coming availability of low-cost, take-home, and point-of-care tests. Because I think people with a little bit more information, having a stronger sense of whether or not they're infectious or not is the kind of information people are looking for. And so there's going to be an ongoing need. Remember, kids under 12 aren't yet able to be tested. People with cancer aren't able to be tested yet. We don't know how long these vaccines work for. So, we should be moving to say, hey, let's flip the switch off and forget the pandemic ever happened. We're still going through this. A lot of people are at risk. We still have hundreds of people a day dying, which is horrifying. That we're even comforted that it's lower, but still, it's quite high by any other standard. So, knowing whether you're infectious, which I think is what the use case is. I'm going to go into the workplace. I'm going to go to church. I'm going to go to a ball game. Do I want to know if I'm infectious? That's going to be something that, because unlike the flu, right, your body tells you you're infectious when you have the flu. With COVID, your body doesn't always tell you you're infectious before you know it plenty of times. So that's why it's useful. I think there's two other kinds of testing that will remain important. One is surveillance testing that states and local government are going to have to continue to do, and we'll do that in more and more clever ways, wastewater and other non-invasive things to say, hey, you know what, this community is got growing risk. That'll be important. And then, of course, there'll be the traditional testing that you'll get, what people now know as the PCR testing, although I bet no one on the phone, including me, can quite say what PCR stands for. So we will have those needs. I think they will become baked in part of the infrastructure. And Dave's exactly right. We had to turn a bespoke industry into a scale industry in the middle of a pandemic. Let's not do that again. Let's get there beforehand.
I don't think we would disagree with that. So, Dave, now that we're moving closer toward a post-pandemic America, fingers crossed, what are some of the challenges that a company like Amazon faces when we think about whatever normal looks like? And Is there anything that the Biden administration or other governments can be doing to support the recovery of the economy?
Yeah, when we started talking about how much disruption and how much change and how challenging it was at the beginning to get set up and get in a place to keep our people safe for the pandemic, and I thought that was pretty hard and challenging, and I think maybe unwinding may be as challenging or more challenging. Just we've spent so much time ingraining these behavioral things like masks and social distancing, and we've been in this very intense situation for a long time that getting people, moving people out of this back into normalcy is going to be challenging, and particularly in a mix where you have an increasing population of people who are vaccinated, but a group who has not been vaccinated yet. I'm very encouraged. One, I'm excited about the goals the Biden administration has set. I think this goal of 70% by July 4th is a big deal, and a big deal for the country, and something we should all be, running towards and figuring out how we help support and accomplish. And I think the announcement recently by the CDC that enables people to get, who have been vaccinated, it says that you can basically remove your mask indoors and out and be in a relative safe position. I think that's a big announcement, a big change. When I talk to folks in our workforce, I hear a lot of comments like, well, why bother to get, they haven't been working from home for a year. They've been coming to work. And, if I have to keep wearing a mask, if I have to keep social distancing, why do I need to go get the vaccine right now? Why bother? And I think this, following the science and getting the announcements out and continuing to move forward with the safety of the vaccine and this miracle that these companies have created for us with these vaccines, I'm grateful to the companies who have done this and the governments and individuals who have distributed. The path that they've given us forward here is truly a miracle, and it's kind of brilliant. But people needed to see and hear that it was actually a path forward. There was concern, and as Andy said, people researching and trying to figure out what their life was going to be like post-vaccine. And I think as that picture becomes clearer, you're going to see more and more people, I hope, shift and go take the vaccine. And the announcements from the CDC are a good example of that. We communicated that message out to all 800,000 plus of our employees on the afternoon of the announcement, because we wanted people to hear it, we wanted people to know it, we wanted people to use that as a lever to start really pushing it to get more appointments faster for vaccines so we can hit the goals that we all have. And so I think we're going to quickly work in our work environment to figure out how we enable our teams to take advantage of the new freedoms and the return to sort of normalcy of being vaccinated. And how do we do that? And how do we enable the people who have, for whatever personal reason, taken the personal responsibility on themselves to not get vaccinated, but they're going to manage their own situation in some other way? How do we enable them and the vaccinated population to work together is going to be a challenge that I'm hopeful we see some coordinated sort of communication guidance and work from all the various governmental organizations at the state and federal level.
So a question for both of you, as we think toward the future and we're optimistic, what should the role of industry be as we try and build back better?
Well, I'll start. Look, I think, let me just start with this on a personal level. January 20th, I got here in the White House. Almost from the day one, people all across the country called and said one thing: how can I help? Dave and Amazon were among those, the chamber itself, many businesses. And I wish Americans could have heard that call, because I just got this real sense that people are like, hey, we are all in this together. Let us know what we can do. And almost every time I talked to somebody, the answer was yes. Hey, we could use help here. We need help thinking about this. Yes. People shared their ideas and their opinions, of course. That's helpful too. But it's very clear that this recovery belongs to the American public. This recovery belongs to the businesses, the other institutions in our country. it doesn't work unless everybody works through this together. And I think the same will be true for the recovery. We have to acknowledge that among the things lost were not only people's lives, but businesses that people had put their entire family into for decades that may have been lost overnight. And those are real losses. So I think this spirit of building back better means supporting people, individuals and businesses, as they get their legs under them. It means, and I think the American Rescue Plan and the two pieces of coming legislation on infrastructure and on supporting families are critical to that, and businesses can help support that along the way, along the process. And continuing to be understanding and modeling being understanding of one another. Dave said something which just struck me, because I think it's so true, which is how habits are difficult to break in any direction. And it's very easy for someone to say, hey, we just said no mask wearing, why are you wearing a mask? Just as it's easy to say, people are supposed to be wearing masks, why aren't you wearing a mask? And this whole notion of judging one another and side eye, et cetera. But for our society to build back better, I think it's really about us saying, we're going to go to our own, people are going to go at their own pace. This is not going to be dictated, driven by the government. Increasingly, the decisions on how fast we build back are going to be yours to make. Government will do its best to provide guidance and indeed regulate the things that are appropriate to be regulated, whether it's a state or other levels. But that's not going to be the norm as we move out of this pandemic. Keeping each other safe is all of our responsibility.
Yeah, I just add that I think this is well said. I think what happened and what continues to happen is bigger than it's bigger than any individual company. It's bigger than Amazon. It's bigger than any individual company. And I think all these companies are just big collections of people. And I think we've all faced this together. Whether it be citizens of the U.S. and we are all pulling whatever resources we have to help support each other through this, to being citizens of the world. I mean, even right now, India is struggling with an incredible challenge, and I know the U.S. Chamber and all the businesses it represents, along with us, and lots of other companies, are bringing everything they can to bear to support India, and what has been a devastating new surge of cases. And I think one of the things I'm hopeful for here, and maybe this sounds a little pie in the sky, but I'm hopeful that one of the things we all learned here, or we'll take away from this, is that really we are all connected globally, and not just in the U.S. but also globally, and that all these companies and big organizations and big groups of people can, when working together and challenged with big objectives, can come together and can figure things out, can solve these problems, and can sort of really deliver sort of some fundamental miracles, like vaccines and in record time, and the kinds of humanity that we've seen from people around the world, big and small, has been. I think there's some real gifts out of this that over the course of time maybe we can take and channel into a way to continue to figure out these public-private partnerships. How do we make them better? How do we make them bigger? How do we tackle the big challenges facing us, whether it be the pandemic or climate change? I think it's going to take a mix of these public-private partnerships and people at all levels working together to figure out how to solve these enormous challenges that are in front of us.
So Dave's mention of India brings me to a question for you, Andy. So we expect the U.S. to begin accumulating a significant number of excess doses of the vaccine, probably, or at least according to the estimates I've seen, starting in June. When do you expect the United States to be in a strong enough position to share some of its surplus vaccines with countries like India or other international partners, that are suffering, at this stage of the pandemic?
So unfortunately, this could be my last question. But I so appreciate the time, and I so appreciate each of you out there and what you've done. We have, as we get into better shape here, as more people get vaccinated here, and as soon as the FDA proves that we can begin moving doses overseas as we have already, 10% of the doses that we bought for ourselves are going to go overseas by the 4th of July. And we're going to be net exporters. We're building factories here, creating jobs here, exporting vaccines to the globe. And, that's both an important humanitarian thing to do. It's a good business thing to do. It's a good public health thing to do. So with that, I'm going to unfortunately have to say I've got to run, but I so appreciated being with everybody today.
Well, thank you to Andy Slavitt and Dave Clark for joining us today. I'm going to throw out what I was going to say at the end of this, and I'm actually just going to quote something that Andy said earlier. We're all in this together. Let us know how we can help. Thank you for joining us today, and thank you for all the work that all of the businesses have been doing to help vaccinate America. Have a good day. Be well.